Okay, so I'm just going to prepare to enter into the room. I'm just going to wash my hands and I'm going to gather my supplies. So right now I am just standing at the doorway. I'm just evaluating my patient, looking to see if they look good or if they look bad. I'm going to assess, I could be looking at their respirations from this point as well. I'm going to assess like the general behavior of the child. If I can tell if anything's wrong from here, just kind of get them to warm up to me. And I would have washed my hands at this point as well. So I'm just going to walk into the room. I'm just going to introduce myself to the patient's family and to the patient. So I'm just going to tell them my name's Harley and I'm going to be your nurse today. And we are just going to be doing an assessment. I'm going to identify my patient with two forms of identification. So they would have a wristband on and I would just look at that and then ask the parents if that was the right birthday and name, just because the baby couldn't tell me. I would then have the parents ask any questions if they had any questions. So now I'm just going to move into my vital signs. So I'm just going to start with the blood pressure. So I would do the blood pressure. It would be between, the systolic would be between 70 and 90. And the diastolic, which would be between 50 and 65. The pulse rate would be between 90 and 120. The temperature would be between 36.4 and 37.6. The respirations would be between 25 to 40. And then, so since this baby is having some respiratory problems and he does have an ear infection, I think if the baby was crying, then the pulse rate and the blood pressure could both be tacky. The oxygen could be decreased because of the respiratory things that we have going on. So if it was below that limit, then we would administer oxygen as well. If the baby had a fever going on, it could be higher and we could administer, with the doctor's order, Tylenol or something like that to help with it. So then I'm also just going to come in, I'm going to do the OFC. Just going to measure around. So the OFC on this baby is 35 centimeters. Let's put that back in there. I'm also going to check the perla, so just checking to see if the pupils are equal and the reactant to light and that they are accommodating. Everything looks good there. The pupils are constricting. I am also going to assess the Glasgow Coma scale. This baby should be at a 15. I'm going to assess the skin turgor and making sure that everything is okay there. I would listen for the apical pulse for a full minute, making sure everything was okay there. I would check the, so now I'm just going to move into the cardiovascular. So I've kind of already been doing that. So I would, just like I said, I would assess the pulses, the brachial, and then I would assess down here for the pedals. I would be making sure that these were at the same force, that one wasn't stronger than another or weaker. I would assess for edema down here. I would do the cap refill. You could do it on their chest or their fingers. I would then move into the respiratory system. Also in the cardiac, I would assess for diaphoresis, see if they're sweating, anything like that. Now, moving down into the pulmonary system. So I'm just going to listen to the 6 lung sounds on the front. And I'd be doing these bilaterally. Then I would do 2 on the sides. And then I'm just going to roll my baby over and do 6 bilaterally down the back, 3 on each side. So at this point, I'm also going to be assessing for cyanosis, seeing if there's any grayish or bluish around the mouth, on the toes, or on the fingers. I'm also going to be assessing the work of breathing, if there's any retractions going on, any nasal flaring at this point. I would also be looking now to go into the gastrointestinal. So at this point, I'm gonna just ask the parent, since the baby can't tell me when the last bowel movement was, making sure that it wasn't like a week ago or anything like that. I am going to first look at, I'm also going to ask the parents about nausea and vomiting, if they've noticed any vomiting in the baby, any signs of nausea, anything like that. I'm going to just look first, see if there's any obvious distension, anything going on there, any masses that I can see. I'm then next going to also take and listen. Just checking bowel sounds, making sure everything's okay there. I'm then going to palpate, and I'm gonna see, like, if feel for any tenderness, if the baby cries or anything like that, if it's firm or soft. Just making sure that I'm not feeling any masses or anything like that. So now I'm going to be moving into the genital urinary system. So with this, I'm going to assess the urine, if it's any weird color, if it smells weird, if the baby is having any pain when they urinate, if they cry. And I'm also going to ask the parents as well, if they've noticed anything to that effect. So now I'm going to move into the musculoskeletal system. So with this, I'm just going to put my hands right here on the baby, and if they can grip mine, that's good. I'm going to do it at the bottoms of the toes. Could go like this, and if the baby curls their toes. I'm then going to do range of motion, making sure the baby can move okay, that everything moves all right. I'm then going to do making sure when they grip my hands that they were both equal, that everything was okay there. I'm going to now move into the skin. So I'm going to look for any discoloration, anything like that going on, any bruises. I take the diaper off and look for a diaper rash, any thing to that aspect. I'm going to assess the turgor on the sternum. It goes right back down, so that's good. I'm going to check the IV site, making sure that there's no infiltration, phlebitis going on there. I'm also going to just overall make sure that the skin is dry, pink, and intact. I'm going to look at the mucous membranes inside of the mouth, making sure that they're wet and pink. And then at this point, I'm going to also assess the fontanelles, making sure that they look okay. There's no problems there. So during this, I've been trying to teach the parents the things I'm doing, answering any questions that they have as well. So I'm just going to let them know that the baby is on antibiotics and that they need to finish up that full set of antibiotics. Don't stop taking it before it's over, because they won't work most likely. I'm going to teach them the signs and symptoms of cyanosis that they could be having. It would be gray and blue around the mouth, on the fingers, and on the toes. I'm also going to, while I am explaining all this to them, I'm going to evaluate the baby, and just throughout my whole assessment, I'm going to be looking for the psychosocial part of this. If the baby cries and is super unhappy, I'm going to note that. I want to see if they're calm, and I understand that they might not be very calm because I'm a stranger, you know, but I'm just going to see how the baby interacts with the parents, that kind of stuff. And then going to just wrap my baby up, and I'm going to move into the 6 rights of medication. So it's going to be the right patient, the right dose, the right medication, the right route, the right time, and then the right documentation. So I'm just going to come over here, I'm going to wash my hands, and then I'm going to apply my gloves. Okay, so so for the Rocephin that I'm going to be giving my baby for the antibiotic, I'm just going to explain to the parents what 2 side effects could be of it. So there could be a rash or something could go on where I injected the medication. It could be sore. They could possibly have nausea and vomiting. And then just for the Tylenol, there could be a GI problems, and it could cause clay-colored stools. So when I go to give my injection, I'm going to have an alcohol prep here, which I don't, but I would clean off the top of that, and I already have these drawn up. Then I would clean off the skin. I'm going to uncap this, come over here, and it's clean. So I'm going to just inject, never recapping, putting that in there. And I would either have another nurse with me so that we could do this at the same time, or I would suggest to the doctor maybe getting, since this baby has an IV, just a bolusing it in. So then I'm just going to come over to this one. I had already cleaned it. Shoot that in, putting this away. Then I'm going to give the baby the Tylenol. Then just giving him back his passy. And I also would have the parents just up at the head of the bed comforting the patient as well. Then at this point I would just remove my gloves. I'm going to clean up all my equipment. I'm going to leave the patient in a clean, comfortable environment and answer any questions that the parents have.